Okay, everyone, good afternoon. Thank you for joining us during this busy holiday time. Welcome to today's webinar entitled Decarbonization in Healthcare, Focusing on Infrastructure. My name is Sapna Tortel, and I'm the Managing Director for the University of California Center for Climate Health and Equity. The mission of the center is to harness the expertise and leadership of the health sector to drive ambitious climate action for health and health action for climate. So today's webinar is actually part 2 in a series on decarbonization. Part 1, which we hosted a few weeks ago, focused on the clinician perspective and what clinicians can do to support decarbonization in their practice. We know that the healthcare sector in the US is responsible for between 8 to 9% of the country's emissions and has multiple sources of greenhouse gas emissions. So today, our speakers will focus on building infrastructure and discuss topics such as energy efficiency, electrification, and renewable electricity, and what the University of California's hospitals are doing on the decarbonization front. I've had the pleasure of working with all of today's speakers in the past on various climate-related projects, and I'm looking forward to hearing from them. All of our webinars are recorded and available on our website. Today's will be recorded as well. And as we conclude our fall events, I want to thank both the UCSF Office of Sustainability as well as the UCSF Academic Senate Committee on Sustainability for their support and contributions to this series. So now I would like to introduce today's webinar moderator, Anna Levitt, the Manager of Energy, Utilities, and Infrastructure at UCSF Health. Anna is a licensed mechanical engineer in California with more than 17 years of experience in energy engineering and program management, 15 of those spent at the University of California, including at another campus, UC San Diego Medical Center and campus. At UCSF Health, she oversees the facility's decarbonization, energy and water efficiency, HVAC controls, and infrastructure renewal programs. In her work at UC San Diego, she managed the campus's $95 million energy efficiency program, which included major research laboratory building HVAC retrofits, cogeneration plant heat recovery, lighting retrofits, and retro commissioning. I'll turn it over to you now, Anna.
Thank you, Sapna, and thank you all for being here today. Of my 17 years in the industry, my last 7 have been in healthcare. Coming from the non-healthcare world, I was surprised at the time and frankly a bit disappointed to see how much work still needed to be done in energy and decarbonization in the healthcare realm, even within the University of California system. Over the last few decades, healthcare in the US has had an implicit and sometimes explicit free pass when it comes to energy efficiency and decarbonization, with justifications that patient safety and system reliability must trump energy efficiency and decarbonization every time. But in the last few years, I've witnessed significant shifts in the industry, where there is now broad acknowledgement that, in fact, safety and reliability are not at all mutually exclusive with energy efficiency and decarbonization. And in fact, they can often benefit one another. As part of a study on central utility plant systems for hospitals that I performed, I interviewed a dozen or so central plant operators and managers at hospitals. And one of my major takeaways from those conversations is that, for the most part, they felt that any central utility plant system, decarbonized or not, could serve the needs of the hospitals so long as the reliability and resiliency weren't compromised. What they cared about more than the types of fuels being used was the level of equipment redundancy. Even amongst regulators and accreditors, the tide's shifting. As of 2020, hospitals are no longer exempt from the California Energy Code. And this year, for the first time, the Joint Commission, which provides accreditation for over 20,000 hospitals across the country, created a sustainable healthcare certification for hospitals. OSHPD, now known as HCI, which provides regulatory oversight of hospitals in California, is in active conversations with some of us about how to advance decarbonization in healthcare. Healthcare institutions are now actively building all-electric, carbon-free facilities, including 2 ambulatory surgery centers here at UCSF and a hospital at UCSF that will be 92% carbon-free from day 1. As for our existing healthcare infrastructure, we have an enormous investment to make to decarbonize it, but I firmly believe that it can be done and that we have most of the technologies needed today. Our speakers will talk about some of the critical work that's happening to help push that forward. I've worked with both of our speakers in the past, and they've both been mentors to me over the years. It's my pleasure to introduce them. Our first speaker will be Walt Vernon. Walt is the CEO of Mazzetti, an employee-owned benefit corporation whose mission is to bend the climate curve. Walt is also the founder and CEO for the Sextant Foundation, a not-for-profit organization providing renewable energy development services for low-resourced healthcare facilities around the world. Walt has a long history helping healthcare organizations to decarbonize. For example, he was a founding board member for Practice Green Health, served on the board of Healthcare Without Harm. He also wrote the background paper for the US National Academy of Medicine's Action Collaborative to decarbonize the US healthcare system. And as an engineer, Walt has designed some of the lowest carbon facilities in the country, including a number of demonstration projects for the California Energy Commission. The latter include the first 2 renewable energy microgrids serving as backup power systems for hospitals. Our second speaker will be David Phillips. He is the Associate Vice President of Capital Programs, Energy and Sustainability in the University of California's Office of the President, and his responsibilities include physical, environmental, and capital planning, design and construction, facilities and asset strategies, real estate, energy, and sustainability. David and his 50-person team help connect researchers, students, and operations staff to integrate sustainable practices in support of the university's mission. David has been in this role since 2015 after working at UC Davis for 20 years. One key focus is developing plans and actions to reduce operational greenhouse gas emissions and implement UC's transition to fully decarbonized energy systems. Before I turn it over to Walt, I want to let you know that we will have a few minutes for Q&A at the end. So please submit your questions on the Q&A feature of the Zoom chat at the bottom, and I will share them with the speakers later on. Walt, I will let you take it from here.
All right, so I hope you can all see my screen. Wait, yes, now you should, right?
Right.
Okay. All right, well, thank you, Anna. It is a real honor to be here and to solve in 15 minutes the problems of decarbonizing the healthcare sector. You know, we work with clients all over the country who are grappling with this challenge, and we hear all the time from people, we don't know how to start even, and it's really hard, and you know, we don't know how we're going to do it, and I think that's right. It is really hard, and it is hard to know where to start. But one of the things that I think is really important is that it's really imperative that we start, because the longer we wait to work on these issues, the harder they're going to become. So what I was going to do today is to try to tackle 4 big obstacles, maybe a 5th one I'll throw in is cost at the end, for why it is difficult and what we hear in terms of objections, why we can't do it, all the reasons why we can't. And I'm going to talk a little bit about some of the ways to try to overcome some of these. The 4 things that I'm going to talk about in particular are the electrical grid. We hear all the time, oh, we can't do it because the grid doesn't have capacity, the grid is too dirty. I'm going to talk a little bit about the problem of existing buildings. I'm going to talk a little bit about issues around ventilation codes, right? A lot of people talk about ventilation codes. I'm also going to talk a little bit about the National Electrical Code and some things that are happening there that are actually maybe opening doors for us that could be helpful. So let's start with the grid. This diagram shows the percent of energy from renewable sources across the country, and it's obviously widely variable. And so, in a lot of hospital owners will say, we are better off to burn natural gas on site than to get electricity from a dirty grid. And in the short run, that might actually be true. But at the end of the day, for us to really achieve decarbonization as a sector, the only answer is for us to electrify everything and to derive our electricity from renewable sources. Obviously, that's a trick. The estimates are that we need to increase our renewable energy generation by about our total consumption, electrical consumption, will go up by about 300% between now and 2050 as we electrify. And so we've got to increase the capacity of our systems and do it with renewable sources in a very short time. And so that's sort of counting on a lot. What I will say is, first off, the National Academy of Engineering tells us that 80% of electrical consumers, that's both commercial and residential, already are in jurisdictions, states, utilities that have goals of achieving 100% carbon-free electricity by some date. The dates vary, but the point being, the grid is moving towards renewable sources. You know, this is, like everything else these days, highly political question. There are even now lawsuits being filed at FERC, which regulates transmission lines, based on people trying to prevent transmission of renewable energy from one place to another. The obstacles are immense, but we are moving. And much of what happened in the Inflation Reduction Act and the previous Infrastructure Investment and Jobs Act is targeted at specifically improving the greenness and the reliability of the grid. So that's, I think, we can't use the excuse that just because the grid is dirty today, we can't do anything. Second is the problem of stranded assets. That is to say, if I install something today that is going to burn natural gas, because of the way economics works and accounting works, I'm going to want to keep that thing there until it dies. I am not going to want to replace it, even if the grid gets greener. So if we invest in combustion of fossil fuels today, we are essentially dooming ourselves in many ways to not being able to achieve decarbonization. So moving to electrification now has got to be what we're after. Third issue is procurement. I think David will talk a little bit later probably about some procurement issues, but depending on which state you're in, the procurement opportunities for green electricity through various mechanisms are growing rapidly. And so I think that creates opportunities for us. And last but not least, as we electrify, we start to send a demand signal to the utilities that we do, in fact, want greener electricity. And those demand signals matter to the people who want to make money by selling us electricity. So go all electric, number one. Second big problem is existing buildings. Existing buildings are very difficult in all kinds of ways. The good news in many respects is we have been working for a long time on figuring out how to improve the energy efficiency of existing buildings. When I was working with the American Hospital Association on its Energy to Care program, one of the things that was really interesting is the worst performing buildings were the easiest and cheapest to improve because they had so much opportunity. And you know, there's so many resources out there about retro commissioning, about things you can do that will have almost no cost, immediate payback. Energy efficiency, you know, taken to the nth degree is where you must start. But you also have to electrify existing buildings. I was going to point to the California Energy Commission. The California Energy Commission produced a decarbonization design guide for healthcare. It was theoretically targeted at new buildings, but much of what's there applies equally to existing buildings. That guidebook actually turned out to be an online updated resource that is free and accessible to anybody, wherever you live. So I highly recommend it. And I'll just give you one little example. We recently posted a video featuring Scott Zabowski, who's an engineer with Ascension and MedExcel, talking about their programs to electrify sterilization, cart wash, and a number of their sort of chronically fossil fuel fired uses inside their hospitals. And he talked about the different ways that they've done it, some of the lessons learned, and how they're actually saving money by doing this electrification. Because we always hear, oh, electricity is more expensive than natural gas. But the experiences that you'll be able to learn on this site, like those from Scott and Ascension, will help all of us, I think, to move in a more aggressive direction towards the electrification we need. The third thing that I want to mention very briefly about existing buildings, we work with a lot. I'm working with a client right now in Colorado whose diesel generator just failed, and they're looking at replacing it with on-site microgrid. This was mentioned earlier. The California Energy Commission has now funded 2 pilot projects, which are, one is up and operating, the other one is close to up and operating. And these pilot projects are showing the potential for replacing diesel generators with on-site microgrids, at least some of which is renewable. And we can talk about that more in Q&A if you wish. So a lot of opportunity there. For those who don't know, CMS this year passed a categorical waiver allowing the use of the new codes that permit these renewable energy microgrids. So huge, couple what CMS did with the IRA with the demonstration projects, with the changes to the National Electrical Code, we've got such an opportunity as an industry to really make big leaps forward in new and existing buildings. The other thing I was going to say very quickly about existing buildings, you will typically hear the advice that you should first go in and measure what you're doing, benchmark, and then build a plan, and then start to do something. And I will say, in terms of the urgency of this, ASHRAE in 2022, their board adopted a resolution that for ASHRAE, this decarbonization agenda is now more or as important as energy efficiency was during the energy crisis days. And so ASHRAE is shifting its focus to this. And I think, that's highly significant, because what the scientists tell us and what ASHRAE is committing to is zero carbon new buildings by 2030 and substantial reductions in existing buildings by 2030. So we have a lot of work to do. We need to get to work and do it. So don't wait to measure. Don't wait to build a plan. We know already a lot of things that can be done very quickly, very inexpensively to improve existing buildings. For heaven's sakes, let's get to work on those while we then think about the stuff that's harder. All right, the next thing I wanted to talk about is ventilation. If I can get there. Is this not working? Okay. So I hear a lot about ASHRAE 170, and people will say, well, we have all these code requirements and they're very difficult and they require, and it's definitely a factor. I will say another thing that ASHRAE is doing right now is working on a design guide for decarbonized new hospitals. That will be published this spring. That has a lot of ideas about how to deal with hospitals, even with these kinds of air change challenges for us. I will point out that both the ASHRAE's position document on building decarbonization and its position document on infectious aerosols both note that we don't have very good data today on the performance of ventilation systems versus transmission risk and what it takes to mitigate risk. We have a lot of theoretical models, but we don't necessarily have good data. What I'm showing you on the screen, you may be familiar with. It's a study that was done by, again, the California Energy Commission. It was done at a Kaiser hospital. And one of my colleagues helped run this program. And what we tried to do was to test the actual particle removal at different air change rates versus the theoretical modeled. And what the data shows, and you have to go read the article, but what it basically shows is the increase in air changes doesn't necessarily lead to the improvement in removal of particles from the breathing zone that we think they do. So this issue of additional research is really critically important. And I really encourage organizations like the University of California and others. This is a place where we really need good quality research. I'll tell you, a number of years ago, we did a study to allow the use of displacement ventilation in healthcare facilities. And we ended up having to spend, it's embarrassing how much money we had to spend, but we've created both a theoretical model and physical models. And we tuned the theoretical model to actually match the actual model. And then we were able to show, using the CFD analysis, that displacement would provide better removal of particles from the breathing zone. But it was extremely expensive. And actually, we have some in-site installations already in healthcare. And one of the things we need to be doing is looking at those and saying, okay, how is that actually working in practice relative to conventional ventilation systems? So anyway, there's tremendous opportunity for research institutions to really make a difference, but you've got to get to work. I'm just an engineer. I'm not a research guy, so I need you guys to do that. All right, air change rates. I want to talk for a minute about the National Electrical Code and some of the opportunities that it has created. I mentioned before, renewable energy microgrids. Interestingly enough, hospitals are the only building type, and healthcare buildings, I guess I should say, that are allowed by the NEC to use renewable energy microgrids for emergency power sources. The healthcare portion of the NEC has been actually pretty aggressive at moving into a new era of new technology availabilities, and I applaud them for that. A couple of things that they're also doing that are really important, and right now we're getting ready for another public comment period for the NEC. And I sit on that panel. We could use your help. I can tell you, and if anybody's interested, let me know. But one of the things we're looking at is new demand factors for sizing electrical systems in a couple of different ways. What this is going to allow us to do, if we do it, is to make our systems smaller. I think most of us understand that when we install electrical systems today, they tend to be about 2 to 3 times bigger than the actual loads they will see. That makes it expensive, it makes it space consuming, and it makes it difficult to coordinate with the utility, especially as we start moving to all electric buildings. So what the NEC is starting to do is to look at new demand factors, which will hopefully squeeze that down to closer to reality so that we can afford to do the kinds of buildings that we must do to move into the future. I'm running out of time, so I'm not going to talk much more about that, but I will say there are opportunities here. And it is really important that users of buildings, that designers of buildings weigh in these processes, because we can complain about them all we want to. But if we want to make change, we have the power to do it, and we must come together as a community to make it happen. The last thing that I'm going to talk about just for a second is money. Money is always a barrier. Obviously, the IRA is out there and is helpful in many respects. But the other thing that I just want to mention is a quick story. Years ago, I was working with Kaiser Permanente and really trying to push Kaiser to use third-party financing of different methodologies to really help them with some of their aspirations about, at the time, it was green buildings and energy. And I remember one day a person walked into the room and said, well, I'm from the Treasury Department, and I've decided that energy is no longer a facilities issue. Energy is a financial issue, and I'm going to help. And that man was a genius, a financial genius. And one of the things he taught me was you can design financial situations and solutions every bit as much as you can design technical solutions. And I think we live at a time now when, as designers, we've got to be designing simultaneous equations. We can't just think about the technical anymore. We can't think about how we're going to pay for it by itself. We have to think about what are our technical options? What are our financial options? What are our procurement options? What are the laws allowing us to do? What's happening in the greater grid? And how do we design solutions that take us where we want to go? And we can do it. And with that, I think I'm really out of time, so I'll have to yield here.
Thank you, Walt, so much. I'll take it from here. That was, I think, all of you are going to hear a very unified message here, kind of at different scales. So I work in the central office for the University of California, and I'm going to be focusing in on the work that we're doing to decarbonize our systems and provide some examples of what's working and where the challenges are. So I'll share some screens here. So just a little, for those of you not familiar with the UC system, here's a map that shows where we're located. The summary is we're a big system. We have 10 different campuses and 5 medical centers. And that gives us the opportunity to really try out solutions in a whole range of different climates and scales. And we have a lot of people that work and study at UC. So we're up to almost, we're over 500,000 people that are associated with the University of California's operations. So we're big. Our climate goals have been modified over the last year, and I'm so thankful because we used to have the goal to become carbon neutral by 2025, and I had a really hard time explaining that to my mother and many other people. We've simplified our goal and really made it much more laser focused in that our goal now is really for us to become fossil free no later than 2045 as part of our overall mission to create a more equitable, sustainable, resilient, and healthy world. And I'm happy that we have healthy in that and equitable, which aligns with the work that's being done at the center. And our vision for this, of course, is to develop solutions, but not develop solutions specifically for the UC system, but solutions that are really scalable and that will work for others as well. So I'm going to go through to talk about the basic strategies of how we become fossil free and decarbonize our systems, and they're kind of in a priority order. The first one is to grow in a very smart way. Don't make the problem worse. UC and especially our health enterprise has tremendous needs to grow to serve our communities. And we've done a lot of pioneering work on smart growth for new buildings. So our standard now is that we build all of our new buildings to LEED Gold as the baseline standard. And as part of our design, we prioritize energy efficiency. So we go beyond building code to beat those standards by at least 20%, or we use our own standards that have been proven possible for our systems that are energy performance targets. And we were one of the first institutions to mandate that we construct all electric new buildings. And since then, a lot of communities across the country have done the same. Generally, it's working quite well, and we're very pleased and proud that UC Irvine committed to this and is developing an all-electric new hospital there in the Irvine campus. Okay, next step, energy efficiency. As great as renewable electricity is, it still has impacts, and so energy efficiency needs to continue to be a focus for all of our operations. And we have had a tremendous amount of success doing energy efficiency programs across the UC systems. A particular challenge for our medical centers and health enterprises has been the fact that the standard historically for rates of return have been higher for UC Health than they have been for the campuses. The health system really has so many opportunities for investments that the standard energy efficiency projects that work on a campus have had a harder time getting traction at UC Health, and I think that's part of what Anna had mentioned in her introductory remarks. But as she remarked, things have really changed, and I've seen a big turnaround with UC Health. And now we have really leaders like Anna that are taking us in a new direction to do energy efficiency work across all of our systems. The next action is to do on-site renewables. Typically, this is solar energy in the form of photovoltaics. And across the UC system, we have a huge amount of success there. We are kind of by far the leading institute of higher education for renewable electricity, as reported by the US EPA. And they come at all different scales. That one at the top left is 0.0015 megawatts. It's used to just charge some cell phones. The next one is 4.2 megawatts. Has the benefit of providing some shade and also LED lighting at night for that parking lot. The next one is one of the largest behind-the-meter solar systems in the country. It's at UC Davis at 16 megawatts. So we have well over 100 different installations across the UC system. It's been more challenging on our health enterprise because they don't typically have the same footprint and opportunities to do large-scale solar on those locations. So, but that means that they're still purchasing a lot of electricity from the grid. And as Walt noted, kind of across the board, the grid is getting greener, but it isn't completely carbon free. So one thing that UC was able to do, given the scale of our operations, is we created our own power company. So we operate something called the UC Clean Power Program, which is providing all of the electricity to 7 of our campuses. And as of 2019, we have gone to zero emissions electricity across that whole program. So it makes it very easy for our participating medical centers to enjoy those reductions in greenhouse gas emissions. So a location like UC Irvine, again, their medical center is served by this. They effectively have zero emissions associated with electricity since 2019 because of that. Hey, and the good news is this has also been a payback for UC. We just did a recent study to compare the rates that our locations are paying relative to the utilities. And over the life of this program, we've saved the locations over $60 million. So it's cleaner and it's less expensive. That's the target we all aim for. We do that through off-campus procurement of renewables. That picture there in the top left is from the Central Valley. That's a 60 megawatt site that we contracted with to get long-term energy. And the wind project is our most recent one. Believe it or not, that's in New Mexico. We're the first off-taker for the electricity from that site. Overall, that project is generating 3,500 megawatts of renewable electricity, and the team is putting in a 500-mile distribution line to connect that up to California so that we can take it off of our grid. So a lot of success there. I think generally you don't need to worry so much about the electricity if you switch. So that leaves us to the big challenge within UC Health and elsewhere. We've made historical investments in what's called combined heat and power plants. Those are our own power plants which burn natural gas and generate electricity, and as well as providing heating and cooling to our locations. So as Walt mentioned, that was a big sustainability move when these were installed. This was by far the cleanest way to produce electricity when these were first put in place about 30 years ago. And they're extremely efficient, and I think we can be rightly proud about the environmental benefits of those projects over their life. They are a very significant asset, and as Walt mentioned, some of the newer ones, there are concerns about it being a stranded asset, but we do need to start shifting away from those, and I'm pleased to say that many of our locations are figuring out that transition for our central heating and cooling plants. Another issue that we've heard a lot about that's made some reluctant to switch from the combined heat and power plants is the fact that these do provide some resilience to our medical centers. That is true, although when we've looked into the history, still the primary backup for our medical centers is diesel generators, at least to begin with. In the case of a prolonged power outage on the grid, they can provide electricity to our medical centers, but really I think our hope is that we need to support California and other locations to make their grid reliable so that everybody has continuous and long-term access to clean electricity from the grid instead of having to put in their own power plants. But there is a big challenge. The conversion of those central plants system-wide is going to cost UC some $6 to $10 billion. Yeah, that's B with a billion with a B. So it's a big transition that needs to happen. So our optimistic goal is to balance these three goals of maintaining reliability, cost effectiveness, and to secure a 90% reduction in fossil fuel use across our systems. That is a challenge, but as Walt said, we need to take it on and provide that leadership to make it happen. So, went the wrong direction. So where we are now in terms of our climate action policy and work, we're focused on direct emissions reductions. We were fortunate enough to be supported by the state of California to receive some $12 million in funding so that we can do detailed decarbonization studies of our central heating and cooling plants. And all of our locations are now have taken the baton for climate leadership and are coming up with their own reductions for reducing their use of fossil fuels, with the end date no later than 2045. So this is what the timeline looks like for those decarbonization studies. Most of our locations will be engaging very actively with their whole communities. So if you're not already, I would encourage you to get involved in these decarbonization plans so that you can lend your voice and support to make it happen. And in theory, these are going to be, the studies are going to be completed by next summer. And then by January of 2025, each location will have specific targets for reductions with 2030, 35, 40, and 45 as the milestone dates. So back to the core challenge and a little bit of scale. UC's operating budget is huge, like everything with UC. 47 billion or so is our operating budget. The medical centers represent about a third of that and growing. So big budgets. Overall, though, the vast majority of our funds go to staff. That bar chart on the right shows where our core funds go across the UC system. And you'll see there that the vast majority of it is for staff and faculty salaries and for benefits associated with those programs. So utilities are typically a very small fraction of that. So finding the funding that we need to make this transition has been a challenge for health as well as for the campuses. We do an annual update to our capital financial plan. I would just note that the locations have a lot of competing goals here. We've got a lot of challenges with our existing buildings being old and needing a lot of upgrades. We have requirements for seismic safety upgrades, so our buildings fare better during earthquakes. Regulatory requirements. So decarbonization is just one of many inputs into these goals. This year's capital financial plan has 30 billion in funded projects. I've inserted a slide that shows where the medical center projects are going. There's not currently a huge slice of that that's going for the transition of our central heating and cooling plants. So we need to continue to provide voices to our leadership to note that this is important and this is where we should be investing. So my takeaways are that leaderships at all levels matter. I'm proud to report that there really has been a big change at UC Health in terms of the leadership being provided at all levels. The recent sign-on to the White House's health sector climate pledge is one example of that. We should be pushing for all electric new construction everywhere. Energy efficiency continues to be a priority, and I would ask for all of your support. Sometimes this can be disruptive to operations, but it's really important and needs to happen. So even if the paybacks aren't on par with buying a new MRI machine, I hope that we can continue to support that work and make that happen. Do solar where you can. Where feasible. If not, there's plenty of options to purchase renewable electricity through green tariffs, through other programs. Whatever you do, don't invest in new gas-fired infrastructure. It's a cul-de-sac. It's a waste of money. We need to stop doing that. But recognizing that this transition away from fossil fuels is going to be very expensive and it's currently unfunded, but it's central to our mission. It's central to our mission to protect health and provide community service, and it's not a departure from that. And I hope all of you can amplify that message. And with that, I'll end, and I look forward to any questions you may have.
Thank you, David. Thank you, Walt. I encourage all folks to take a moment to think about any questions you may have and enter them into the question box. And also some of them have been answered live for those who weren't following along. There's some in the answered column if you want to take a look there. I will start with a question, and Walt, if you could come back and join us, that'd be great. Relative to the on-site solar that you were talking about, David. So the question is, for your on-site solar, do you own the RECs, the renewable energy credits? One thing that we struggle with in a faraway state is that the utility takes the RECs for on-site solar, so it doesn't count toward our carbon reduction goals.
Yeah, definitely we own the RECs. I think this maybe varies a little bit from location to location, but generally speaking, when you put a solar project behind the meter, you shouldn't do a deal with a third party who's going to own the renewable energy credits, because that would effectively be double counting. But it's pretty straightforward for our locations. We put them in behind the meter. That results in us buying less electricity. We don't do any transaction for renewable energy credits at all. So we own the RECs. We don't do anything with them. We just don't sell them and don't purchase that equivalent amount of electricity.
All right. There's been a question about transportation, which is a little different of a topic from the infrastructure we're covering, but I'll pose the question and see how well we can answer it. How does UC Health support healthy and sustainable modes of transportation at the locations? What kind of funding is available for these programs? Do any of our entities collaborate with local agencies and elected officials to facilitate better, healthy, and sustainable transportation in their communities? And do current guidelines for the selection of UC Health offices support the provision of car and bicycle parking, et cetera, to reflect UCOP sustainability goals? David, you want to take that one?
Yeah, I'll take it. Yeah, thanks. I'll give a shout out to Dr. Khan. Thanks for that question and for your advocacy and support for bicycle transportation and other transportation modes. I should have noted our long-term goals do include transportation, both business travel and commuting travel. And my presentation, of course, focused mainly on buildings. So the Office of the President, we are a decentralized organization of all of those operating funds. Those go to the campuses and medical centers. We don't centrally provide funding for programs at all. Like all of our climate work, we've had some great support from the Office of the President, but it's on the tune of like $1 million a year to do all of the work that we're doing to support the campuses and medical centers and climate. So we certainly do have sustainable practices policies that encourage sustainable transportation. And my recommendation for those of you who don't see enough of that happening or want to see more would be to advocate locally, because I think that's really where the action happens. The question about future UC locations is complicated. I know recently UC Health has really been acquiring new properties to expand our reach and expand health. Frankly, I don't know that transportation is central to some of those decisions, but it's a very good point, and I'll definitely make sure that we review this as part of the transactions we do.
Thank you. This looks like it may be another question for you, David. The Academic Senate Memorial had a much shorter timeline than our policy timeline. Do you have any sense, or are there interim goals that will show when we will get 75% there?
Yeah, I really appreciate the advocacy and work that was done by the Academic Senate for that memorial. We have folded in one of the leaders for that into the chair of our fossil-free task force that is working through all of these issues. So we when we had the carbon neutrality initiative, it was often viewed as a top-down initiative. And I think part of this shift towards fossil-free operations is really to hand the baton back to local leadership to set their own path and get their buy-in. So I'm seeing that working. So the locations that are developing their decarbonization plans, although we have 2045 as the end date, the furthest possible date, I'm seeing a lot of action to encourage and to support leadership to take action much sooner and actually, maybe not to get to the 90% level as soon as what the academic senate wanted, but to do what's possible. And really, to me, the main barrier is financial feasibility. So that's where we really need advocacy to. We don't have the funds currently identified. We need support from the state. There has been some success there, like the UC Berkeley campus was able to secure some funds to begin their transition away from fossil fuels on their campus at their central plant. So that's our hope. We need to work together to really identify funding to make this happen as quick as possible.
All right. Well, this one probably can go to you, and I'm happy to chime in as well. Do you design buildings to passive house standards for maximum efficiency?
Yeah, that's a great question. In healthcare and in particular hospitals, the regulations are pretty severe in most places in ways that make it somewhat difficult to use passive systems. I will say ASHRAE is just issued recently an addendum on natural ventilation to allow mixed mode systems, which is really fantastic, and it's certainly moving in the right direction. The other thing that I would say about some of the passive standards, architects like lots of glass in buildings, which can make things difficult. And there's always a tension between envelope and performance of systems. But the other thing, and I mentioned before the ASHRAE design guide for decarbonized hospitals. One of the things that we're actually starting to pay attention now to is something called embodied carbon. That's a concept that really has been now put into law in the state of California, although we don't have the specifics yet. But when we start to think about embodied carbon, which means how much carbon does it take to create an inch of insulation? And if you can sort of imagine balancing each inch of insulation has a diminishing impact on how much energy is saved in an operational sense. And so there becomes a balancing question about how much of one do you invest in versus the other to get the best overall minimum carbon in a life cycle sense from a building. So the questions are not trivial, and it takes work to figure out the best balance of these things. And ideally, as we become better and better at this, and it becomes more and more a part of what we do every day, I think we will start moving in a direction towards, taking advantage of passive solutions wherever we can.
All right. This one is probably for, well, anybody really. Do you have any plans to create a net zero ambulatory surgery center within your system using solar panels or microgrids as an energy source? I'm happy to field this one initially, if you like. So I would say net zero is not necessarily a term we're actively using for our ambulatory surgery centers, but we are actively building centers that are all electric surgery centers within the system at UCSF and also at other UC Healths. And they are using the carbon-free electricity that David was talking about from the UC Power program. And the challenge with being able to generate sufficient electricity on site, frankly, is a lot about space. If we covered every single inch of the building with solar panels, it would be a tiny fraction of the electricity that the building really needs. But thankfully, we're working together to have the broader system be able to serve these all electric buildings, and they will be carbon free. Anything to add? No? Okay.
You know, Anna, could I just say something about that?
Yeah. Of course.
I would, you know, I think definitions matter a lot here. And one of the things that I worry about when we throw around these terms like, you know, carbon free, net zero, whatever, a lot of it is driven by the boundaries that we measure. And so everybody's probably heard of scope 1, 2, 3, all of that kind of thing. But you know, the thinking about, as an example, which gases are we talking about is a question, because, you know, if we talk about carbon, carbon is one gas. The Kyoto Protocol was, I think, 7 now, with the Kigali Amendment. But there are other greenhouse gases that are not covered by any agreements. And, you know, how we measure being carbon free, I think, is a trick. And so I do think it behooves us to be pretty careful about our language when we make claims, and that we're really clear. We're using, to your point, all electric buildings. We're using all electric buildings with all renewable energy. But what about the refrigerants that are leaked from your ventilation systems, right? I mean, there's so many so many greenhouse gas that we don't always talk about. And so I do think this is an area where we're going to continue. Every time we make a step forward, it feels like the goalpost shifts a little bit in some ways. And now there's a new challenge we have to figure out. And in some ways, that's all the more reason to act with urgency, because the more we act, the more we learn, the more we can improve. And so anyway, it's an excellent question.
Has anyone modeled the cost savings towards health insurance benefits from the UC system from decreasing burning fossil fuels on the campuses? David?
Not directly. You know, again, the health benefits, I think as we switch from our existing cogen plants are you know, fully permitted and don't you know, there's great efforts to not release traditional pollutants from those, but we're you know, overall, we're a relatively small emitter. I think I have seen Kaiser do some efforts like that, of like looking at like related health impacts from each ton of CO2 emitted. But so I know that work's been done, but we haven't like tried to tie it back to health benefits. But maybe Walt has an idea there. See.
Yeah, now I don't know how to put my hand down. I was going to sort of chime in here. You know, this is one of the problems with, I think, this whole decarbonization thing. The mitigation measures that any one institution puts into place will never have a measurable impact on the climate. And so that's really, the answer is zero, frankly. It's not going to change anything. One thing that I do think can matter, and this is something I've actually sort of been trying to explore with the IRS in terms of community benefit for nonprofit healthcare, is the issue of scope 1 emissions. Because a scope 1 emission means you're doing something on your campus, probably you're burning something, and the products of combustion then are released into your local community. And, you know, depending on where you're located, this can be a serious social justice issue, potentially. And so I do think that making investments in reducing scope 1 emissions can actually have probably some measurable impact on local air quality and therefore health outcomes in the local community. But how many of those are the actual insured lives of somebody at UC hospital is hard. I mean, I'm sure you have there would be ways to do it, but I think it's going to be de minimis. And I think the reason for doing decarbonization is not because it's going to save in health costs in that sense. I think the arguments are a different order of magnitude.
All right, we have a question on other types of carbon-free electricity generation. What is your stance? And maybe David can take it first, and then Walt, if you have additional to add. What is your stance on bioenergy and hydroelectric generation fueling in future infrastructure as a decarbonization plan? From today, I saw a huge emphasis on solar, which I completely agree with, and was wondering if you considered bioenergy as a carbon-free resource.
Yeah, so I'll interpret that as I understand it. So definitely hydro gets folded in. There's definitions about what's renewable for the Clean Power Program. Even though it doesn't count as renewable, we do have some large hydro that's part of our portfolio, and we feel good about including that. The bioenergy, I think, maybe is a reference to things like biomethane, which UC has also been a leader in, but I didn't talk a lot about it because it really, in my estimation, it's been important, but it's not super scalable for other institutions. This only works because of the size of UC and the fact that we've got a centralized team going after this. But UC is the largest procurer of biomethane in the country for voluntary reasons. So we have projects in place where things like a landfill that was formerly just collecting methane, some of the methane, some of it leaking out, and burning it. And we've improved the systems there at the landfill. We put our own treatment system on board to clean it up, make it the equivalent of natural gas, and it's being piped into the natural gas pipeline system so that we can take it on our campuses. And per the the greenhouse gas reporting rules, that counts as carbon-free renewable natural gas is what it's called. So I stick by it, and I think our leadership there was important to help develop that market. But I don't want to emphasize it because really what we need to continue doing is direct action to reduce the use of both fossil gas and renewable natural gas on our locations.
I might chime in and sort of agree with everything David just said. A lot of these things, there are both what I might frame as legal definitions of what is renewable and philosophical definitions of what is renewable. And the two may not always correspond. And so David said exactly right. And frankly, different states, different countries, different protocols treat things in different ways. But generally speaking, a lot of these, particularly renewable natural gas, is both controversial and recognized as a renewable source. And in some senses, it is true. If we're going to put trash into a landfill, it is going to off gas, and that gas is going to go into the atmosphere. And if we're able to use it before it goes into the atmosphere, maybe that's a good thing. But if, for example, we reduce the volume of food waste coming from our facilities, then maybe we don't have the same supply of methane coming out of the landfills. And so they're complicated questions. And, we have a lot of work to do as a species to figure this all out. And the other thing that I think, is important about all this is I think it's really important that we not let the perfect be the enemy of the good, because we have got to be moving forward and making progress and learning together. And every time we do something and it's not quite right, fine, let's learn and do better the next time. But for God's sakes, let's move.
Thank you both so much. Unfortunately, we haven't managed to get to every question, but I'm just happy that there's so much interest. And I will turn it over to Sapna.
I echo that. There has been so much interest. Thank you for the great questions and answers. Thank you, Anna, Walt, and David, and to all the attendees for joining our webinar today. This webinar was recorded, and we look forward to sharing the recording with all the folks who registered and all the attendees, of course. In the meantime, happy holidays and enjoy the rest of your day. Bye, everyone.
Thank you. Thanks.